Hi there, and welcome to Mome. My name's Potsy. Today we're going to be discussing drug calculations. Hi everyone, I hope we're all doing okay in these crazy times. It certainly is crazy, yeah. Even I've gone clean shaven at the moment for about the first time in about 10 years. So, hang in there everyone. I hope we're all doing okay. But today we're here to talk about drug calculations. So quite often I get asked by junior paramedics and also some senior paramedics in regards to drug calculations and how we perform them. And, are they really necessary? So I think, we have to understand that no matter what our mathematical skills are, as paramedics, we are required to conduct drug calculations on a daily basis to address and appropriately treat our patients. Okay, so, and often this can be in a dynamic or a challenging or an ever-changing environment, and we might have different kind of stressors going on in that environment when we have to perform these drug calculations. So it's really imperative that we have a really good basis of how and why we do these drug calculations. So, it all comes down to patient safety and treating our patients appropriately. We don't want to underdose our patients, and we don't want to overdose our patients, even more importantly. Quite often the drug calculations that we are doing are for the paediatric cohort of patients, and really important we don't overdose those patients. We don't want to overdose any patients, okay? We want to minimise our drug errors, and the drug errors, unfortunately, they do occur, and quite often they do occur when we are performing these drug calculations. So it's really important that we understand that quite often we can be working just as a two-person team, and therefore both of those team members have to know how to perform drug calculations. And when you are performing the drug calculations, they need to be checked by your other offsider or whoever else is on scene. It's no good just having it a cheat system for it. I'll admit I use cheat systems, but I've always got that ability to perform the drug calculations as well. And if I'm in a really stressful environment, I'll refer back to that and I'll perform the drug calculations just to ensure that it's right. And that my cheat system's not accurate, so to speak, in a stressful environment. So it's also important to understand that, as we are now health professionals, it's expected from us that we treat our patients appropriately and we treat them accurately. So as you can see, these drug calculations are very important in the ability to make up a great paramedic, which is what everyone is aspiring to be. So, when we performing drug calculations, it could be from an IV infusion, could be for a subcut or an IM injection or an IV injection as well. Most of the times when we're giving an IV drug, though, we'll go for simplicity. So, say for example, if we have a drug that may be presented in 5 milligrams in 1 mil, and we want to give 3.8 milligrams of that drug. Well, that drug, I'll make it easy for myself, and I will make that drug up to the 5 mils. So I'll have 5 milligrams in 5 mils, and therefore 1 mil represents 1 milligram of that drug. So to give 3.7 milligrams, I would give 3.7 mils. So think of it simplistic for IV drugs, especially whenever we're doing IV drug administrations. But for our other drug administrations, we can get really complicated with infusion rates and setting up IV drip rates and things like that. But today we're here to talk about the basic drug calculations, which are mainly involved in the IM dosing of drugs. So make it easy for yourself. Practice, and practice. It's the best way to get over drug calculations. And now I'll show you the simple technique that I use for how to perform drug calculations, which involves a simple equation called sunrise over sunset times volume. Alrighty guys, so now let's look at the equation which we use to perform this drug calculations. Now we've got 3 different variables in there. Some equations have x divided by y times by z. I like to use the equation of sunrise over sunset times volume. So we need 3 figures here. We need the stock required, which is sunrise. That's how much drug we want to give this patient. And that's divided by the stock strength. And then that's times by the volume which it's presented in. So as we can see, it's not a hard algebra equation. It's basic division and multiplication. So let's break down the equation and have a look at it. Okay, so the first figure that we need is the stock required. Okay, so that's sunrise, or that's how much of this drug do we need to give this patient. Okay, and we figure that out by our calculation of the age, where we use our equation, how much we want to give. Then we divide this by the stock strength. Stock strength obviously is how much of the stock is in the vial, and then we times this by the volume that's in the vial. Okay guys, so now let's have a little bit of a run through of some drug calculations. Alright, so I've just written up here, this is what my service is, the Luscombe formula for figuring out kilograms if we know what the age of the child is or the patient is. Because a lot of these drug calculations will have to do with the paediatric cohort of patients that we go to. So the Luscombe formula is age times 3 plus 7 equals the weight in kilograms. So we'll keep that up there. Now we've just also discussed that we have stock required over stock strength times volume in mils. So that's the equation we're going to be working through today. So we'll just have a look at a couple of different drugs and a couple of different ages. So I'll use what my service uses, the guidelines out of that, but this can be adapted to any kind of guidelines to whatever your drug doses are. So let's say, for example, we've got a drug like ondansetron, and the pediatric dosage for that is 100 micrograms per kilo. Okay, so 100 microgs per kilo. And let's say, for example, we have a 6-year-old. So just quickly, 6 times 3 plus 7 equals 25 kilograms. Okay, and we want to give this patient 100 micrograms per kilogram. So 25 times 100, well, simply that's going to be 2,500 micrograms. So that's how much we want to give the patient, 2,500 micrograms. And the presentation of this drug, ampule, will be 4 milligrams in 2 mils. Okay, so if we revert this back to the original equation, sunrise over sunset times volume, or stock required is going to be 2,500 mics. Stock strength is 4 milligrams, volume is 2 mils. So we write that into the equation, 2,500 divided by 4 times 2. Now the problem here is, this one, 2,500 is in micrograms, and then our stock strength is in milligrams. These have to be the same, so we need to change that. So to get micrograms into milligrams, we simply divide by 1,000, which we can just shift the decimal place, so it'll be 2.5 milligrams. Okay, so 2.5 divided by 4 times 2 is going to be how much of this drug this patient receives. So let's have a look. There's numerous ways that you can do your long division, but it's going to be 2.5 divided by 4. Okay, 2.5. Alright, so 4 into 2, that doesn't go, so that's going to be 0. Decimal place there, carry the 2 over. 4 into 25, well that goes 6 times with 1 left over. 4 into 10, that goes twice with 2 left over. 4 into 20 goes 5. So 0.625, and don't forget we have to times that by 2. 2 times 5 is 10, carry the 1, 2 2s is 4, plus 1 is 5, 2 times 6 is 12. Put the decimal place down there, and that's how much we have to give this patient, is 1.25 mils. Alright, so for our ondansetron that's presented 4 milligrams in 2 mils, our dose is 100 micrograms per kilo. We have a 6-year-old, that's 25 kilograms. They require 2.5 milligrams, or 2,500 micrograms. Now using this equation, we get it to come out at 1.25 mils. Now another good way that I like to do is just to, once you have done this equation, just to go back and double check it. Does it sound about right? Okay, we know that we have 4 milligrams in 2 mils in our vial. So if you can either divide that into, like halve it, or divide it into 4s, so that you know that for every half a mil, you've got 1 milligram. For every 1 mil, you've got 2 milligrams. So we're after 2.5 milligrams, so it should just be a bit above the 1 mil, and that's what we've got, 1.25 mils. Alright, sorry about the picture there, it's not that clear, but hopefully you get the idea and you can work at home on this as well. So let's take this off. Now let's do another one. Hey, we'll work through something else. Okay, so let's look at another drug now. Hey, let's look at something else we've got in the way. Well, let's look at midazolam. Okay, So our pediatric midazolam dose for an intramuscular injection is 200 micrograms per kilo. Okay. Now our midazolam vial, its presentation is 5 milligrams in 1 mil. Okay. And so let's do this calculation for, let's make it nice and easy. Let's do a 3-year-old. Okay. So I won't write it out all along, but 3 times 3 is 9 plus 7 is 16. So a 3-year-old, according to our formula, is going to weigh 16 kilos. Now we want 200 mics per kilo. So we have 200 times 16. Okay, 6 times 0 is 0, 0, 6 times 2 is 12. Put the 0 down, then we have a 0, 0, 1 times 2 is 2. Add those together, 0, 0, 2 and 3. So for a 3-year-old, according to our equation of 200 micrograms per kilo, they require 3,200 micrograms. Now we know from the last one, we want to get these units into the same, okay? So our presenting vial is 5 milligrams. That's easy to make this 3,200 micrograms. Divide that by 1,000, so just move the decimal place back 3 places and we get 3.2 milligrams. Now we can chuck all of this into our equation like we did before. Stock required is 3.2. So 3.2 divided by 5 times 1. Now, as I said before, long multiplication, you can do this on a bit of paper, you can do it on a calculator. I like to do it on a bit of paper because you never know whether or not you're going to have your phone with you or a calculator, so this is a good backup to have. Alright, so let's go 3.2 divided by 5. Different ways to do this, I know that, but this is how I was always taught. So 5 into 3, that goes 0. 5 into 32, well that goes 6. Then carry the 2. 5 into the 20, that goes 4. Okay, so what have we got there? We've got 0.64 times 1. 0.64 mils is the answer that we get for how much midazolam are we going to give a 3-year-old, for example. Okay, and we can figure it out. We can have a bit of a look at it too. Okay, so we know that we've got 5 milligrams in 1 mil. We want 3.2, so it's a bit over a half. That's right, yeah. And 0.64, it's a bit over half a mil. So pretty happy with that one there as well. All right, let's do one more. What's another drug we can do? Let's keep the 3-year-old there, 16. Now one that always gets everyone, and everyone always just says look on the back of the bottle, but we should be able to do it. This one will be a nice easy one for it. Let's have a look at paracetamol. So paracetamol, for our paediatric dose, 15 milligrams per kilo. Okay. What's its presentation? 120 milligrams in 5 mils. Okay, a little bit tougher this one, isn't it? Not really. We just need to know our 120 times tables, or 12 times tables. So let's figure it out. 15 times 16. Let's do that one first. We'll figure out how much this child requires. So 6 times 5 is 30. Carry the 3. 6 ones is 6, plus the 3 is 9. 0, 5, 1. Add those together, we get 0, 5 and 4 is 14, carry the 1. 240 milligrams is what this patient requires. Okay, so looking at paracetamol here, our stock required is 240. Our stock strength is 120, and we times that by 5. Well, this is a bit of an easy equation, isn't it? So that's going to be 2. Because 120 goes into 240 twice. So it's going to be 2 times 5, and that's going to equal 10. 10 mils. So a 3-year-old child will require 10 mils of paracetamol. Now it gets a bit complicated. I made that a bit easier with that equation, but you can get the general gist there of how we put this equation into our drug calculations. Alrighty guys, so that's a really quick run through of drug calculations. If you can master that, then you're going to be on the road to becoming a lot better paramedic. That equation is quite simple, but we need to know how to use it. And when we do use it appropriately, we're going to make sure that our drug calculations are accurate and appropriate. So stay safe out there, guys. It's trying times at the moment, I know that. But once again, if you've got any queries, concerns, or questions, feel free to drop us a line at home. We're on Facebook, Instagram, and Twitter. Stay safe, guys. We'll see you soon.